Assalamu alaikum and welcome to the lecture on provision of pharmaceutical care in multiple environments. I am Shay Muhammad, lecturer in the Department of Pharmaceutics, Faculty of Pharmacy, University of Sindh. So this is the outline of the lecture. In this lecture, we will be having the introduction to the professionalism, the challenges that are faced by the professionalism, incorporating professionalism into the practice, cultural traditions, and cultural competence in pharmaceutical care. So the professionalism in healthcare is an old age concept. Professionalism is defined as the conduct, aims, or qualities that characterize or mark a profession. A profession is recognized a group of people who provide a significantly recognized service central to human values that cannot be provided by the average layperson. Because of their service to society, professionals receive benefits, special recognition, and greater autonomy than non-professionals. However, along with the benefits and the autonomy professionals enjoy, greater expectations and a higher degree of trust is also demanded by the society. Pharmacy is also a profession. Despite the challenges to professionalism presented by changes in healthcare, pharmacists must embrace the responsibilities that stem from their profession's guiding principles. Among these responsibilities are advancing the well-being and dignity of their patients, acting with integrity and conscience, collaborating respectfully with healthcare colleagues, and seeking justice in the distribution of healthcare resources. The rising interest in professionalism has been attributed to the perception that changes that are occurring into the healthcare delivery are eroding the professional standards of healthcare providers. The changes that are occurring onto the routine basis are putting pressures onto the healthcare professionals, and the workload on them is increasing, and it causes problems into the provision of services. Among the changes confronting the pharmacy profession are managed care's continuing emphasis on cost containment. The pharmacists are put in pressure that the cost effectiveness of the therapy should be carried out, and in certain situations that can also put pressure onto the pharmacist. The increased demand for systems that ensure the safety of medication use, technological-driven changes in the pharmacy core responsibilities, the most important of which is an expansion of pharmacists' role in patient care and a prolonged shortage of pharmacists. So these changes are putting pressure onto the pharmacists, like the safe use of the medications. The more responsibility onto the pharmacist is there to use the medication safely, and there is more responsibility of the patient-oriented services to the by the pharmacist. And as these responsibilities are increasing, the shortage of the pharmacist is also increasing. As such challenges mount, it is in the best interest of our profession and the public we serve to reaffirm our foundational principles. So, despite of these pressures, how we can incorporate professionalism into our practice? The American Society of Hospital Pharmacists encourages practitioners, administrators, faculty members, and pharmacy students to contemplate and to incorporate into their practices the guiding principles set forth into the Code of Ethics for Pharmacists and the following 10 characteristics of a professional. So these 10 points should be present into a pharmacist as being a professional. First is the knowledge and skill of the profession. The pharmacist has must have proper knowledge of the knowledge and skills about the pharmacy profession. Second is commitment of self-improvement of skills and knowledge. So the pharmacist must have commitment that he will improve himself. Third is service orientation. Fourth is pride in and service to the profession. Covenantal relationship with the patient. creativity and innovation, conscience and trustworthiness, accountability for his or her work, ethically sound decision making, and leadership skills. Cultural traditions characterized by values, beliefs, attitudes, practices, and customs of a group of people are passed from generation to generation. Within this framework, culture reinforces the general design for living and pattern for interpreting reality. In fact, cultures represent learned patterns of thought and behavior. So people have followed their cultures and they try to be along with their cultural tradition. They don't try to change and incorporate new things into their society. So, as such, people have culturally embedded perceptions about what constitutes disease and its causation. So, the different people have different perception that how the diseases are caused, how they are progressing, or they have also perception about appropriate healthcare seeking behavior, to whom they should go for the seeking healthcare behavior. Next is the quality and usefulness of the medical encounters, effective approaches to heal, including both conventional and alternative practices. And last is the role of family in the healthcare. The cultural competence is an important strategy for dealing with culturally diverse individuals and is increasingly recognized as key measure of quality of care. It has been defined as the capacity of individuals and programs to acknowledge and respect the cultural traditions of their clients. So, the pharmacist is required to provide the services to the patients, even from wherever they are coming. They are rich or not, whether they are Muslims or not, whether they are coming from a lower caste. The responsibility of the pharmacist to provide the services without the cultural or ethnic differences. So this is all from my side. Thank you very much for your time.